Welcome once again to Philgood Services. Today we're going to talk about the general overview of the various topics that we'll be talking about, some of the perceptions about mental illnesses and then what the reality actually is. And then we'll also be talking about the various diagnoses that there are for mental illnesses. And it will interest you to know that there are over 200 diagnoses out there for mental illnesses. So there is very broad scope that we'll be covering as time goes on. Patients with mental illnesses also have a lot of stigma that comes with it, which makes it very difficult for them to be able to share their experience with others. And as time goes on, we'll be talking about some of the stigma that comes with patients with mental illnesses. And we will also talk about the stigma also associated with people that work with patients with mental illnesses. I quite remember one time when a friend of mine came to my workplace and then asked, "Hey, where are the patients?" I was like, "Oh, they are in this unit." And then he was like, "Oh, so that's where the crazy people are?" Those are some of the words that people use for patients with mental illnesses. Or you tell someone that, "Oh, I work at an inpatient psychiatric hospital." "Oh, so you work with the crazy people?" No, they're not crazy, right? So those are some of the things that we will be talking about. And then we'll also be addressing how rewarding it is to work with that kind of population. It is very rewarding. It's easy for anyone to treat the body, but it's very difficult for someone to treat the mind. So your ability to be part of those individuals who are taking care of the mind makes you very special, makes you very different. And it takes special people to take care of those patients. And then we'll also talk about the challenges. Obviously, there are challenges working with the psychiatric patients or mentally ill patients, no doubt about that. So we'll be addressing some of the challenges and how you can make it very easier and accommodating for you to work with them. And then the family of the patients also have a lot of challenges, either from friends, from other people, in relation to how they can take care of their loved ones. And it's also very challenging because of the presentation of those patients. So we'll also be talking about some of the challenges that the family also goes through and how they can manage it. We'll also talk about how to reduce burnout in the staff that work with psychiatric patients. It is very important because when the burnout is evident, it is transferred to the care that we provide for the patient. For the families and friends also, it is very important to be able to identify the red flags or the symptoms that someone will have if they have mental illness. So we'll also be talking about some of the symptoms as we talk about each diagnosis. We'll talk about the symptoms that comes with it so that it will be easier for you to identify and be able to provide assistance to the loved one. We'll also talk about the various help that is available out there for patients and families. There are so many support groups that are out there and so many other psychosocials that we have to involve in to be able to help the patients with mental illnesses. The next thing that we'll also talk about is the self-esteem. Low self-esteem is something that really impacts the well-being of everyone. So when people have low self-esteem, it is very evident in their unnecessary expenses that they bear, because they tend to buy things to compensate for what they think they do not have. It is also very difficult for people with dependent personality disorder, avoidant personality disorder. It also contributes or attributes to people with depression, anxiety, because they feel low of themselves to the extent that they don't want to be out there. They feel anxious to go to public places. It makes them so depressed that they stay at home all the time. And then they always try to be like somebody else because they do not believe in themselves. And we'll talk about all these and how it affects us as individuals, and then also how it affects our mental illnesses. Other things that we'll also be talking about is the attention-seeking part of people with low self-esteem. They tend to be very attention-seeking. They always want people to empathize with them, sympathize with them. So we'll talk about some of the things that we can do to help build our self-esteem and to be able to be independent, to be able to be meaningful in society, to be able to believe in ourselves and walk with our heads high and our chest out. And then they always seek for other things to compensate for those. So you find them indulging in activities, behaviors that are not really typical of who they are. And then they also have low body image or body image issues. Actually, they have body image issues. So they tend to have other disorders such as eating disorders, which factors contributing to their low self-esteem. So in general, these are some of the things we'll be talking about. So do not miss out. And then please go ahead and like our Facebook page, and then follow us also on Facebook, and then also subscribe to our YouTube channel as we bring you these educative videos every Sunday at 3 o'clock, and you'll be the first person to receive it. Thank you very much.